Hi, I'm Dr. Jesse Scholes, physical therapist in Wanago, Wisconsin. Today, I'm making a video for my patients or someone else who's been told to apply a product called dynamic tape to their hip to help them walk better or function better or for some sort of rehab purpose. Now, again, I'm making this video specifically for those individuals that have been told this should work for you. I want you to do this, but I'm still going to give you some general words of advice. Any sort of tape can irritate the skin, whether it be an allergic reaction or just, we'll say just some sort of skin reaction to the tape. So what I generally tell people is wear the tape for up to 3 days at the longest. But if you have any problems with the tape whatsoever, it's making something feel worse, you've got a little bit of an itch where the tape is, it's causing a rash, something like that, take the tape off. This product, dynamic tape, I've got a 2-inch roll here and a 3-inch wide roll here, can either one be applied to these muscles to help it function better, to help with knee pain, hip pain, and or back pain, depending upon what you're using it for. Now, the gluteus medius and minimus muscles live on the outside part of the hip here. If you put your hand on the outside part of your hip, there is a bony knob there. And that's going to be where one end of the tape is going to go. The other end of the tape, if you put your hand kind of on the bone right by the love handle area, the center part of that bone on the outer part of the hip is where the other end of the tape is going to finish. So, how you're going to do this, make sure your skin is free of lotions and or oils or anything else, and we have to make sure that we apply this tape with the muscle in the shortened position. So you're going to be lying on your side, and I appreciate that this is a little awkward, but I find that it provides the least amount of skin wrinkles when you apply the tape this way, which is going to decrease the likelihood of the tape to irritate your skin. But you'll be lying on your side, and you're going to lift your leg up and back behind you. Now, I know you can't really see this very well how I'm positioned, but if I stand up, I'm going to move my leg out to the side, away from my other leg, and a little bit behind the body. This position, especially if we rotate the leg out, my left toes to my left, will maximally shorten some of these muscle fibers here. So, now, if you get yourself onto your side and you lift your leg up towards the ceiling and you bring it a little bit behind your body and your toes are facing up towards the ceiling a little bit, you know where the ends of the tape are going to be? Again, one end of the tape is going to be on the bony bump. The other one's going to be on the top of the middle of the bone, right underneath the love handle. How do you apply the tape? Very simple. You cut a piece of tape with very sharp scissors so it doesn't kind of destroy the tape. Sharp scissors are a must with this. And I would recommend cutting it to a length about 2 to 3 inches shorter than that distance from the bony bump on the outside of your hip and the top of your hip crease. So right here, where my thumb is where that top of my hip is. So I would cut it probably right about here where my index finger is. About 1.5 inches, 2 inches down, I would say, for me and my body. And when you put this tape on then, you're going to put one end of the tape on with no stretch, probably about 1/2 inch to 1 inch of tape with no stretch on the bottom. And then with your leg in this position, you're going to put enough stretch on the tape so that it can rest in that final position with the other end of the tape on the top part of that bone here. And that's probably going to be about 25 to 50% of the maximum stretch you can put on this tape. But again, the tape should finish like this, and you have to be in this position to do it. Now, could you do this standing rather than lying down? Absolutely. Could you have a friend do it? Absolutely. If they apply the tape to you, it does not matter. But you do have to have a fair amount of skin exposed here in order to do this. Now, I showed you with the 3-inch wide tape how to apply it. If you have a 2-inch wide piece of tape, how can you do this? You could either apply one 2-inch piece right up the middle, or you can split them. So you put one piece here and you kind of curve it a little bit this way to the top of the bone. It's the same end points. And the other piece here, and same thing. You don't want to put any stretch on the ends of the tape. You just want to lay them down. Or you can take two pieces of tape and run them up right next to one another. This tape does not like to stick to itself very well. So I'd recommend that if you put it on next to each other, you do not overlap those two pieces of tape. And again, 3 days at the most is how long you should wear the tape for. Take it off early if there's any problems whatsoever. If you've been wearing it for a long period of time and you know your skin tolerates it very well, you can probably manage to wear it a little bit longer without an issue, but I would exercise caution with that. Also, when you're taking it off, sometimes taking it off in the shower is a little bit easier. You want to pull the tape away from your skin and then pull the skin away from the tape. Also, you can use conditioner, a little bit of Vaseline, a little bit of baby oil, something like that to help that tape, we'll say, unstick to your skin a little bit. I have found from personal experience that the longer the tape is on your skin, the better it bonds to your skin, i.e. the harder it's going to be to pull it off. Obviously, if you have hairy areas where that tape is going to be applied, it's going to be more uncomfortable when you take it off. You could do a little bit of shaving before you do it to make that skin a little bit smoother so it doesn't hurt as much. Otherwise, I hope this video was informative. I hope you understand better how to apply this tape, but thanks for watching.